Do you wake up every morning with a dry mouth as if you've spent hours in a desert? Most people simply roll over, grab a glass of water, and carry on with their routine. But what if that dryness has nothing to do with thirst? What if your body has been sending you a silent warning for months, maybe even years, that no one taught you how to interpret? There's something that always leaves me thinking deeply when I talk about this topic. Chronic dry mouth upon waking affects nearly 1 in 3 adults over 60, and in the vast majority of cases, it has absolutely nothing to do with how much water they drank the night before. Nothing. Yet, hardly anyone talks about it. It's not discussed in most pharmacies. It's rarely mentioned during annual checkups. It's simply a conversation that never happens. Stick with me until the end because the number one cause I'm going to reveal to you today could be in your medicine cabinet or on your nightstand right now, and it may be causing much more than just a dry mouth. We're talking about something that can affect your kidneys, your heart, and your brain all at the same time. If you find this topic important, please click the like button right now so this information can reach more people who really need it. Welcome to this space. If you're new here, you should know that this place was created for men and women who want to stay strong, sharp, active, and independent after 50. And if you're already part of this community, thank you from the bottom of my heart for joining me again today, because the topic we'll be discussing in this video may be one of the most important for aging with dignity and autonomy. What I'm going to explain today challenges an idea that many of us have silently accepted for years, that aging means living uncomfortably, that waking up with a dry mouth is normal after a certain age. I want to be completely clear with you, that's not the whole truth. A dry mouth upon waking may seem insignificant on the surface, but on the inside, it can completely change your life. Now let's talk about what's really going on inside your body when you wake up with a mouth that feels like it's full of cotton. Your mouth constantly relies on saliva, and saliva isn't just water. It's an extraordinarily complex biological fluid packed with enzymes, antimicrobial proteins, minerals, and protective substances that defend your teeth, gums, throat, digestion, and even your immune system around the clock. When the salivary glands begin to weaken, or when other body systems start to fail, saliva production decreases. And when that production drops too low, your mouth starts to dry out, especially at night when you're not drinking, talking, or naturally stimulating saliva flow. After age 60, your body produces 30 to 40% less saliva than in previous decades. And while that reduction alone represents a real vulnerability, the real danger arises when it's combined with the 7 causes I'm going to show you today. Because none of these causes simply dry out your mouth. Each one points to something much deeper happening inside your body. And here's what worries me most as a doctor. Chronic dry mouth is linked to up to a 45% increased risk of systemic infections in adults over 60. Saliva is your mouth's first line of immune defense. When it disappears, bacteria, fungi, and viruses find a direct route into the bloodstream. So let's go through these 7 causes together, from the least concerning to the one that alarms me most in my practice. And when we're finished, you'll know exactly what signs to watch for, what to tell your doctor, and what changes you can start making tonight. But before we begin, I want to ask you something personal. How long have you been waking up with a dry mouth? A few weeks? Several months? Years? Leave your answer in the comments. I read every single one of your comments, and often your answer helps someone else watching this video realize they're not alone. Now, before I show you the part that really blew me away, the technique that takes this information to an incredible level of understanding, I have to mention something. Everything I'm sharing with you now about the signals the body sends through a dry mouth is just a small sample of what we've compiled in our comprehensive health guide for this stage of life. We've created 4 volumes that address, in a practical and in-depth way, the fundamental pillars of aging with vitality. These are 101 natural remedies for everyday life, where you'll find simple solutions for everyday ailments. The ultimate longevity plan, which guides you step by step toward a longer, healthier life. The complete guide to heart and blood pressure so you can take care of your main engine with clear strategies, and men's health after 50, prostate, energy, and vitality, an indispensable resource for men who want to maintain their strength and well-being. There's a special offer available right now to access all these materials. You'll find the link in the description and a QR code on screen. That's the rest of the life-transforming knowledge. But let's get back to the causes, because what I'm about to tell you is the game changer. Cause number 7 on our list is probably the most common one I see in my practice and also one of the most ignored: mouth breathing while you sleep. And before you think this is normal or unimportant, I need you to listen carefully to what I'm about to tell you. Breathing through your mouth at night is almost never just a habit. In my clinical experience, it's almost always a sign that something deeper is happening inside the body. When you sleep breathing through your mouth, air constantly passes over your tongue, palate, and the back of your throat. This continuous flow evaporates moisture at a rate your salivary glands simply can't compensate for while you sleep. And then you wake up to that rough feeling like you have sandpaper in your mouth, chapped lips, a thick or whitish tongue, even a sore throat without being sick. But there's something that worries me far more than dry mouth itself, because mouth breathing while you sleep is often linked to nasal congestion, a deviated septum, nasal polyps, or sleep apnea. And sleep apnea in particular is not something to be taken lightly. Studies show that untreated sleep apnea is associated with a 60% increased risk of stroke and nearly a 40% increased risk of heart failure. If you wake up with a dry mouth and also snore, feel exhausted even after a full night's sleep, or someone has told you that you sometimes stop breathing while you sleep, please talk to your doctor about having a sleep study. That single conversation could change much more than you imagine. Now, for people whose mouth breathing isn't related to sleep apnea, the solutions are often quite simple and surprisingly effective. A nasal strip placed across the bridge of the nose before bed can greatly improve airflow and help the body return to breathing as it was naturally designed. A humidifier in the room set between 40 and 50% humidity significantly reduces moisture loss during the night. Sleeping on your side also decreases the tendency to breathe through your mouth. Now let's move on to cause number 6. And this is where I see one of the most frequent mistakes because it seems perfectly logical until you understand why it doesn't work. Most people who wake up with a dry mouth think the same thing. I need to drink more water before bed. So they do exactly that. They drink a large glass right before turning off the light, and the next morning they wake up just as dry, sometimes even more frustrated because they feel they did everything correctly and nothing changed. Here's the problem. The body doesn't hydrate instantly. When you drink water, your body needs anywhere from 30 minutes to 2 hours to absorb it, distribute it to your tissues, and use it for functions like saliva production. The water you drink at 10 p.m. does very little for your mouth by 6 a.m. By then, the opportunity has passed. The real problem often occurred hours earlier or wasn't addressed during the afternoon. In fact, research found that adults over 60 who didn't stay properly hydrated between noon and 4 p.m. were 62% more likely to experience severe dry mouth overnight. 62%. And that's far from a small difference. After age 60, this becomes even more difficult because the thirst mechanism begins to silently fail with age. You can be seriously dehydrated and still feel almost no need to drink water. Furthermore, many people cut back on fluids in the afternoon to avoid getting up to use the bathroom during the night. And while that's completely understandable, it creates a hydration deficit that peaks right while you sleep when you can no longer correct it. The solution isn't to drink more water before bed. The solution is to hydrate much earlier. Aim to drink 6 to 8 ounces of water with each meal and also with afternoon snacks. Cause number 5 takes almost everyone by surprise because very few people imagine that diet could be directly related to something that happens inside their mouths every morning. But here's the reality. Salivary glands aren't passive structures. They're metabolically active tissues that need specific nutrients to function properly at the cellular level. And there are 2 nutritional deficiencies that impair salivary function in adults over 60 years of age faster than most people realize. The first is vitamin A. This vitamin is essential for maintaining the health of all the body's mucous membranes, the mouth, throat, nasal passages, and even parts of the digestive system. When vitamin A levels begin to decline, these membranes become thinner, drier, and gradually stop functioning properly. Studies have found that adults over 60 with low vitamin A levels experienced up to a 41% reduction in normal saliva production compared to those with adequate levels, and that's not a small difference. It means their salivary glands are functioning at only a fraction of their true capacity. The second deficiency involves B vitamins, especially vitamin B3, known as niacin, and vitamin B12. A lack of niacin directly disrupts the nerve signals that trigger saliva production from the brain, and a vitamin B12 deficiency causes something even more noticeable. The tongue becomes inflamed, abnormally smooth, sensitive, and persistently dry, a condition called glossitis. And when both deficiencies occur together, they create a dryness that no glass of water can completely resolve. Because the problem is no longer hydration, the problem is happening inside the cells. Now we come to cause number 4, and this is probably the combination that deserves the most attention in my practice. If this is happening to you, I need you to listen carefully, not out of fear, but because of the importance of detecting it early. If you wake up with a dry mouth and also get up more than once a night to urinate, that combination is a clinical sign that I never ignore, because those two symptoms together are often one of the first warnings of high blood sugar and, in many cases, of undiagnosed type 2 diabetes. This is what happens inside the body. When blood glucose exceeds a certain level, the kidneys work tirelessly to eliminate the excess sugar, and to do so, they begin to extract water from the body's tissues. In other words, the body begins to dehydrate from the inside out. And one of the first places where that dehydration is felt most acutely is in the mouth, especially overnight when you have no way to compensate. What's most concerning about all of this is how long it often goes unnoticed. Research has found that 63% of adults newly diagnosed with type 2 diabetes reported a dry mouth upon waking, and most had been experiencing it for more than a year before receiving their diagnosis. More than a year with their bodies sending out warning signals every morning without anyone interpreting them correctly. And now we come to cause number 3, a condition that affects approximately 4 million people, and yet the average patient takes almost 3 years from the first symptoms to finally receiving a diagnosis. 3 full years, and that's not a failure of medicine. It's a failure of the conversations that happen, or never happen, in doctors' offices. The condition is called Sjögren's syndrome. It is an autoimmune disease in which the immune system mistakenly attacks the body's own glands responsible for producing moisture, especially the salivary and tear glands. The result? Persistent dry mouth, constantly dry eyes, difficulty swallowing, and, in more advanced cases, much more serious problems that can involve the joints, lungs, kidneys, and physical exhaustion that slowly erodes quality of life. Women over 60 are by far the most affected, representing nearly 90% of diagnosed cases. So why does this disease take so long to detect? Because each symptom is treated as if it were a separate problem. Dry mouth is attributed to age or dehydration. Irritated eyes are blamed on screen use or allergies. Joint pain ends up simply labeled as arthritis. And while each specialist looks at a different piece of the puzzle, no one is really connecting the dots. And all the while, the autoimmune process continues silently progressing. I want you to remember this sign. If your dry mouth is accompanied by burning, gritty, or constantly irritated eyes, especially if you are a woman over 60, ask your doctor to specifically evaluate you for Sjögren's syndrome. Say it by name. There is a blood test that looks for specific antibodies, anti-SSA and anti-SSB, which can identify the disease in many cases. And you have every right to ask for that test. Don't wait for someone to suggest it. Now we come to cause number 2, and this is one of the most surprising on the list because almost no one would associate a dry mouth with something like this. But the connection exists, it's documented, and everyone over 60 deserves to know about it. Your salivary glands don't work on their own. They're controlled by the autonomic nervous system, specifically the parasympathetic branch, which is responsible for rest, recovery, and many automatic bodily functions. When that system begins to deteriorate, saliva production also drops, and the mouth starts to dry out. The truly important thing here is this. Dysfunction of the autonomic nervous system can be one of the first signs of diseases like Parkinson's or Lewy body dementia. And some studies show that these changes can appear 4 to 6 years before the classic motor symptoms that usually lead to diagnosis. And now we come to cause number 1, the one I see most frequently in my practice, the most ignored, the worst explained, and frankly, the one that most deserves a direct and honest conversation. More than 500 commonly prescribed medications list dry mouth as a side effect. More than 500. And when we talk about adults over 60 who on average take 5 or more medications a day, the cumulative impact on the salivary glands and also on the brain can be much more serious than most people imagine. The medications that most frequently cause this problem include antihistamines, antidepressants, blood pressure medications, bladder treatments, antipsychotics, and certain pain relievers, especially muscle relaxants. But this is where the situation becomes truly worrisome. There's something called anticholinergic burden, and I need you to remember that term. Anticholinergic burden is the cumulative effect that occurs when several medications block a key brain substance called acetylcholine, a neurotransmitter essential for memory, attention, and numerous other nervous functions. Numerous studies have linked a high anticholinergic burden to accelerated cognitive decline and a significantly increased risk of dementia. Dry mouth isn't the end result, it's the visible sign of something much deeper happening silently within the nervous system. If you've made it this far in the video, it's because you care about your health and want to live with more energy, greater independence, and a better quality of life. That's why in our comprehensive health guides, we share how diet, natural remedies, and simple habits can help you regain vitality, strengthen your body, improve memory, support circulation, and maintain your independence for longer. All with practical changes and easy-to-implement tips. Find our guides by clicking the link in the description and scanning the QR code on screen. 101 Natural Remedies for Everyday Life. The Ultimate Longevity Plan. The Complete Guide to Heart and Blood Pressure, and Men's Health After 50. Everything you need to take care of yourself at this important stage is just a click away. Thank you for being here, for listening carefully, and for taking action for your health. See you in the next video.